Well, in our practice, we've been really focusing on two completely different patient types in terms of dental sleep medicine. One is our routine practice, which is a busy two-doctor practice. And if we have a patient that the dental hygienist might suspect because they're clenching their teeth and wearing their teeth down, or because they're snoring in the chair when they're having their teeth cleaned, and if the hygienist suspects that maybe they have a problem with sleep disordered breathing, we're going to suggest that they might consider having a watch-pat study to screen them to see if in fact maybe they have a problem when they sleep.
It's very easy. If you forget, there is an instruction book on the inside that you can follow, or a DVD that helps you remember how to put it on. You need to take off your watch. Can we break it? This goes on facing you. When you put this on, make sure you strap it a little firmly. So this goes on your index finger. You put your finger in as far as you can. You'll feel a little bar at the tip. When you have your finger in place, you're going to pull back these tabs and pull it out while your finger's in there. This one goes on your ring finger, and what I tell most patients is pull this back. This part is going to be like the little pudgy part of your finger, and you're going to put it on there, fold the little butterflies up. I'm not going to peel it off, but you would tape it down and around. This one you put on your larynx. There's a piece of paper so it's sticky. Peel the paper off, stick it to your larynx. Right before you go to bed, just push the button. That's all you have to do, and in the morning just take the whole thing off, stick it back in the box, and you're done.
We're going to put this study together to let you kind of look it over, and we'll be sending a copy to your pulmonologist to show him the results. And just to kind of make it easier for you, I have this folder, and inside it shows the values, and you can compare the data with your original study that we took before we did the oral appliance therapy, and then the data after we've got the oral appliance fully titrated. And I know your physician, your primary care physician, and your pulmonologist will both find this information very useful, so we'll send them a copy as well. But this is for you so you can understand it.
Not really. I did some reading of some literature that Dr. Friedman gave me, and he explained things very well. But it's actually very easy to learn. Well, we had a patient come in just this morning actually, and he has been wearing the device for about a week now, and he made the comment that it's been the first time in many years that he's been able to share the same bedroom as his wife, and he was really happy about that. So I thought that was great.
What we did was we went ahead and used a mandibular repositioning device, an oral appliance, to bring the patient's jaw in a forward protrusive position and bring his tongue base away from the airway, as well as give his airway a little larger caliber while he's sleeping. we've been pretty successful with oral appliance therapy in all of our patients, and we have already gone ahead and done a follow-up sleep study on this patient, and we know that his oral appliance therapy is effective and essentially is giving him a better night's sleep with a larger caliber airway.
I can only speak from the dentist side. You know, I can't speak from a physician's point of view, but in my practice, I never collaborated much with a physician unless I had to call to ask if the patient needed pre-medication for a mitral valve prolapse or something like that. And now all of a sudden, there's this new relationship. I have a patient, I suspect that they snore. By state license, I can't even say they snore or that I want to treat them for snoring without collaborating with a physician. Usually it's a sleep physician. So there's all of a sudden this explosion of collaboration where the sleep physician will call me and say, hey, I've got this person that, you know, they just can't wear their CPAP. Can you see what you can do with an oral appliance? And so this cross-pollination with the meetings, which again has been my experience the last 5 years, is just an unbelievable field of discussion between the two disciplines, and the cross discussion with trying to help patients. So, you know, we're screening so many people. I think eventually it's certainly going to be a large stream of patients coming from the dental practices to the sleep physicians rather than the other way around.